Good afternoon, everyone. Welcome to this event hosted by the Australian Health Promotion Association New South Wales branch, which will focus on the New South Wales Regional Health Plan and its implications for health promotion in regional New South Wales. My name is Luke Giles. I am the MC for this event, and I'm based in Tamworth in northern New South Wales. We've got a great program this afternoon. We'll start with an overview of the new regional health plan, with a particular emphasis on actions to be taken within the strategic priority of keep people healthy and well through prevention, early intervention and education. We'll have a focus on how health promotion practitioners can contribute towards achieving the strategy and improving health outcomes for people in regional New South Wales as a result. We'll have a panel discussion and Q&A session after the main presentation, and that will provide an opportunity for participants to ask questions about the plan, allow for discussion on how the plan could be practically implemented, and discuss opportunities presented by the plan. If you have any questions for the Q&A session during the event, feel free to send those through via the chat, or you can also ask those questions when we come to the Q&A session. In terms of housekeeping, it'd be great if you could please keep your microphone on mute during the event, unless you're asking a question when we come to the Q&A session. It'd be great if you can turn your camera on, and that way we're able to all see who's joining in the event today. And yes, we are recording the event as well. So before we get started, I'd just like to acknowledge the traditional owners of the lands we're meeting on today. I'm joining from Kamilaroi land in northern New South Wales, and I'd like to acknowledge the traditional owners of the lands across New South Wales where other participants are joining from. I'd also like to pay my respects to elders past, present and future, and to any Aboriginal and Torres Strait Islander people who are joining the event today. Please feel free to use the chat function as well to say hi and to let us know what lands you're joining on today as well. So to get started, I'd just like to introduce our main speaker, Michelle Maxwell. So she'll be delivering the main presentation on the Regional Health Plan. So Luke Sloan from the Ministry of Health was scheduled to deliver this presentation, but unfortunately was unable to attend today. But a huge thanks to Michelle for stepping in to deliver this presentation. So I'll just introduce Michelle. Michelle Maxwell is the Director of Strategy, Governance and Delivery in the Regional Health Division of the New South Wales Ministry of Health. The Regional Health Division was established in April 2022, and Michelle has been in this role since that time. Michelle is responsible for the New South Wales Government's response to the Rural Health Inquiry, the new Regional Health Strategic Plan, multi-purpose services, the Isolated Patients Travel and Accommodation Assistance Scheme, the Regional Health Ministerial Advisory Panel, and other governance groups. Michelle has more than 30 years experience across New South Wales Health, in local health districts and at the Ministry of Health. Her previous role was Director of Strategic Change and Communications in the Strategic Reform and Planning branch, where Michelle had a responsibility for value-based healthcare and virtual care and communications. Prior to that, Michelle had more than 20 years experience in population health and health promotion at the Centre for Population Health, the Office for Preventive Health, and the Children's Hospital. So welcome, Michelle, and thanks for joining us today.
Thank you, Luke. Good afternoon, everyone. And yeah, it's lovely to see some familiar faces and familiar names from many years past. And I do feel like a health promotion dinosaur. But I think when I first started, Luke, I was called a health education officer. That's how old and how long I've been there. But anyway, so look, things have moved on, of course. But it's really my great pleasure this afternoon to present an overview of the Regional Health Strategic Plan, how we got there, and also, I suppose opportunities that this creates for health promotion and population health and preventive health in regional, rural and remote areas of New South Wales. I'm dialing in today from Brisbane, so I acknowledge the Mingjil people, the traditional owners of this land that I'm meeting on today. And again, I want to pass on Luke's apology. Luke Sloan, Coordinator General, he was called to a Ministry exec meeting late last week that he couldn't change. So I really very happily volunteered to take this gig for him. And it'll be, my pleasure to share with you the story about the plan, but also to take your questions later on. So I'm just going to start sharing my screen and hopefully that will all go well and you'll be able to see the presentation. I always wonder when it does this PowerPoint live thing that I can't see it, so, and which I can't, so I'm just going to stop that, sorry. Can anyone see my presentation? No, didn't think so. All right, we'll try again, I'm sorry. We did have a practice, didn't we, just before this, so it does work. All right, how's that now? We've got thumbs up. Luke, I can only see you in the corner. Okay, great.
Looking good.
So the Regional Health Strategic Plan was approved by New South Wales Cabinet and published in June this year. And I don't say that lightly because not many strategic plans in health need Cabinet approval. This was one that was seen to be really important across all of government. There's been a lot of work going on across government about regional New South Wales, but it was really important that we had that government engagement and support behind this plan, particularly with the rural health inquiry that preceded it some time ago. So that was a significant, I suppose, approval process. We had to get all the government agencies behind the plan and take it to Cabinet. That wasn't just taken lightly from our perspective, the work that was needed to do that, but also the endorsement of Cabinet. Of course, the government's changed now, but the new government is completely supportive of the plan as far as have we heard so far. So that's a really good sign. In terms of how the plan was developed, and I suppose I should preface this by whenever I talk about regional health, we do mean regional, rural and remote health. So, and I acknowledge the many people who are on this call from regional, rural and remote health services and locations, and your contribution to the plan, and not only in the consultation, but also the development and particularly now the implementation. But just to take a step in how we actually developed the plan, it was informed by extensive consultation, and on the screen you can see a bit of a summary of that, and I'm happy to go into a lot more detail. But we didn't start with a blank slate. We had a previous rural health plan that finished in 2021, so we'd actually completed a progress review of that. We also had, of course, the rural health inquiry that gave us a lot of insights into some of the issues and concerns being experienced by staff and community and stakeholders. And we also commissioned some work from the Sachs Institute to look at really good evidence base around what was effective internationally and nationally in terms of rural health. So we weren't starting with a blank slate. So when we started this work in June and July last year, we already had a bit of an idea around, what some of the priorities could look like, but it was really important to go out and do extensive consultation. And I hope some people on the line were part of those consultations. I know some of you were. So we did the broader consultation piece, 68 consultation sessions with about 1,600 participants, but then we also had some specific and focused consultation with Aboriginal communities and staff, and also some vulnerable community groups. We brought all that together for further internal consultation across health and also the regional local health districts. And then we, went out to some more broader community feedback through the Department of Customer Services platform, Have Your Say. We then, pulled that together and put that back out to the system and to government agencies, and received another 60 submissions from different government agencies and health services to actually develop up the final. And then, as I mentioned, the plan was approved and published in February this year. So that was the path that led to us. And as I said, really happy to give any more details on that. So where we've landed with the vision for the plan, and I hope people have had a chance to have a look at the plan, so you've got some questions, but also, have a good understanding of it. I suppose it's a little bit different from the vision for future health, which is the broader health system strategic plan. And this vision itself was really developed by the Regional Health Plan Steering Committee, who are one of our key governance groups for the plan. So it's around, what they felt was really important through the consultation process, and what we heard was that we're aiming for a sustainable, equitable and integrated health system, delivering outcomes that matter most to patients. So there's that that consistency with Future Health, but specific to regional, rural and remote New South Wales. And I will talk later about the alignment with Future Health. I think it's really important for people to understand that, and the work that we're doing to make sure there's not duplication of reporting, and it's not too onerous for people, and people can see how they all fit together. So if you've seen the plan, this is the headline. There are 6 strategic priorities. This is a little bit different to Future Health, and through the consultation, these were the key priorities people thought were needed to really affect significant and substantial change in health services, and really the population of the health of the population in regional and rural and remote New South Wales. People said that we couldn't do much if we didn't have a really good, strong regional health workforce. So even the other priorities wouldn't really follow unless we had that established. And that's been, of course, the focus of a lot of the discussion. And that's not just health workforce within New South Wales Health, but it's the broader health system, and speaks to NGOs. It speaks to a whole range of partners as well. The second priority was really about enabling better access to safe, high quality and timely health services. And that's really, I suppose, to address, the issues of distance, the issues of, lack of access to GPs and services in some areas. And, to really maximise, I suppose, some of the innovation in terms of virtual care and other things that we really need to build on and make sure, it's not a replacement for face-to-face care, but it really does complement that. They're in no order of priority, these, no order of emphasis for these priorities, but for priority 3, which is the one I know you'll be most interested in, keeping people healthy and well through prevention, early intervention and education. This is one that, particularly in our community consultation, people were really, really keen to make sure it had a really strong voice in this plan. And I think that's a credit to all the work that's gone on in the past, but it's also a credit to the value people see for this, and how people understand that if we don't do this well, then, we're going to really be against it in terms of trying to meet that demand. So it was really well articulated through all the community consultation about the value of population health approaches around preventive health approaches as well. And I'll talk more about that in a moment. The next priority 4, around keeping communities informed, building engagement and seeking feedback. I do want to spend a bit more time focusing on that in a moment as well, because this is one where communities really felt like they had a strong voice in that preventive health focus. So it was around building the engagement with communities around delivering some of those services and some of that work. And as I said, I'll talk more about that in a moment, but communities really felt like to keep them informed and engaged, they wanted to be a part of some of the prevention activities. So let's come back and reflect on that one a little bit. Then priority 5 is really something that I suppose came out quite uniquely in the consultation for this plan, around that seamless integration of primary, community and hospital care. Patients don't really care who delivers their healthcare or their services. They just want to see it as a seamless approach that really supports them at the centre of that approach. So this is something that we've been working with the Commonwealth on, with primary health networks. I see Margie online. We're doing quite a lot of work with the PHNs in this space, but this was seen to be really, really important, where we've got, I suppose, less resources available, but how we all work together to maximise that impact. And there's some really good examples of work happening in that space that I think we're going to be able to roll out statewide. Priority 6 then is around that innovation and research agenda that supports the sustainable health system. And equally, we can't build on what we've got and do that well unless we're understanding how that works and how effective it is. So they're the 6 strategic priorities for the plan, which hopefully you're a little bit familiar with. I just want to focus a little bit more on what we heard during the consultation last year around priority 3. So we asked people, we had some early work. This is before we came up with the sort of detail in the plan. But we asked people about which areas did they think was most important to focus on over the next 10 years to achieve outcomes in this priority. And improving health outcomes through addressing social determinants of health really came up strongly in all our consultations. And, you know, I'm preaching to the converted here. You guys really know around the value of this and that supportive environment addressing a whole range of issues that allows people then to be able to, you know, make some decisions about their own health and take action as well. So, you know, this is where we really need to work closely with other government agencies, with the range of service providers. We won't be able to achieve that on our own. But equally, there was a real strong support for that healthy lifestyle and environment as well, which is a lot of the work that you guys have been leading on over many years, with really great effect. And I think, you know, we've all been through COVID and, you know, some of our resources got diverted to addressing that. But I think this gives us a really good, strong foundation and an authorising environment to start, you know, really working really strongly in this space. I know we meet with the regional chief executives every month around the plan and other work. And this is an area that, you know, through even the work we're hearing more broadly around engaging with the community, and as I said before, their interest in this space, it's something we want to really tackle a bit more with Centre for Population Health with Kerry Chan and Meredith Claremont as well. So that'll be coming up. Health literacy is still seen to be really important in this whole space, particularly for regional, rural and remote areas as well. And then, you know, equally still a focus on the prevention programs, the ones that are really effective and getting good outcomes. And some of them I know quite well from years gone by, like Get Healthy service that I used to manage many years ago. Here's just some other insights. And like I said to Luke earlier, I'm really happy to share the slides and the presentation. So don't be taking notes or whatever at the moment if you don't want to, but, you know, we'll share this so you've got some of this background information as well. But these are some other things we heard during the consultation. Some things I've already mentioned, but that workplace culture of preventive healthcare, making sure that people feel like they have the capability to have those conversations around healthy weight or, you know, vaping or quitting smoking, a whole range of things, healthy pregnancy. And then, you know, coordinating work with NGOs, PHNs, local government and the Commonwealth as well. And then a strong theme around targeting promotion engagement with, you know, young people and other key groups as well. There were a few barriers that were identified that came out, you know, as well, that resistance to change and the effort that goes in also the behaviour change approach, accessing some of the services and prevention programs. But, you know, I know, you know, things are moving more to the online environment and other ways of supporting that, which is great. And then that culturally sensitive and appropriate promotion and prevention activities that I know, you know, is always part of your thinking. So this is just some other insights that we heard during the consultation. So when you dig into the plan, these are the priorities: keeping people healthy and well through prevention, early intervention, education. There's some strategic objectives. There's 5 of those in this priority, and each of those then has some deliverables. So, you know, there's a lot more detail in the plan, and it's quite different to Future Health, where they went at a really sort of a higher level of strategic objectives and priorities. Through all the consultation, we really needed to, I suppose, represent what we'd heard and what people thought was important. And so that's why we've gone into quite a bit of detail about what people think will be needed within the plan. But you can see here how this is quite broad. The 3.5, prevent, prepare for, respond to and recover from pandemics. We just had a discussion at the last Regional Health Committee with the chief executives around that one. It was an area of interest, and we had the Mental Health Commission come and talk around what they're doing in this space and others. So, you know, we do pick up this conversation. The plan doesn't just sit on the table or on the shelf, or not even that in now, it's sitting on your desktop. But, you know, this is something that we're continuing to really have those tough conversations sometimes at all levels of the system around what are we actually doing in this space, and what are some really good exemplars across local health districts where this work is really making an impact. I did want to, as I said, I wanted to come back to this one as well, because I think this is really important in terms of population health and prevention programs. about that, keeping communities informed, building engagement, seeking feedback. And that's why I just wanted to mention it specifically today. As I said, you know, the local health committees and other groups that are engaged in this work really feel and understand the value of prevention. I think they're a really untapped group to maybe, you know, make sure that you're selling your messages to, and any other sort of local community groups like local councils, other people, and really that, you know, what you're doing should be actually meeting these strategic objectives in a way as well, that engaging communities in shared decision making, encouraging choice and control over health outcomes. So I'd encourage you to look at that priority 4 as well as something that I think you can really make the most of, in fact, and the effort going in there also. So just how am I going for time, Luke? We going all right? About
Yeah, got a few more minutes.
okay, all right. I'll scoop through. Thank you. So when we took this plan to Cabinet, we also had to develop a priority framework for the plan, which was some specific targets over the first 3 years of the plan, and also which articulated the key budget commitments. And I just wanted to share the targets for priority 3. These aren't the only targets, but these are the ones that, you know, are publicly out there. So just to keep in mind, we'll be really following up on these targets, you know, by regional New South Wales. We're not particularly interested in looking at each district, but I know that happens anyway within the performance framework in the ministry. But if you want to have a look at the priority framework where these are articulated, it might give you a bit of an authorising environment for, you know, making sure we can reach these targets by 2026 as well. So where are we up to now? We almost finalised some delivery roadmaps for the plan. So these are what we're working on now is delivery roadmap for the first 3 years of the plan. And it outlines the priority actions for implementation, and also it contains the measurement framework as well for the plan. So there's been a lot of work when we first went out to branches and pillars and agencies across health. We got about 600 actions back of people, work that's already underway or planned. And we've rationalised that a little bit because some of them were just statewide actions, which are sitting in Future Health anyway. But so we're coming up with a delivery roadmap for the work that will be done to actually deliver on the plan. And then we've just engaged a consultancy to start planning out the evaluation, and there will be an evaluation at each of those time horizons, so 3, 5 and 10 years. And I'll just show you there how we're going to be reporting on the plan and the roadmaps. So there's quite a bit of detail here, but there'll be external reporting. We'll have a website that will report on the targets. Then we'll have an annual report that will be externally facing and report on the target and strategic priorities. And then that 3, 5 and 10 year evaluation, as I mentioned. In terms of internal reporting, that'll be every 6 months, that we'll be looking at the deliverable and sort of KPI level. So that'll give you an indication of how we'll be able to share information back with you guys and anyone else who's interested into how we're tracking for the plan. As I said at the start, I just wanted to share with you the alignment of a couple of the strategic plans for New South Wales Health. And we haven't mapped the alignment with their healthy eating, active living strategy, but that's something that we work with the Centre for Pop Health on. But you can see in terms of the 3 key big plans in New South Wales Health, the Regional Health Strategic Plan on the left, Future Health Strategy on the right, and then the Health Workforce Plan in the middle. There's a lot of alignment across those strategic priorities and outcomes. And as I said, we've been working really closely within the ministry around how we align reporting and make sure that, you know, districts or services don't have to report the same thing twice. So we're doing all that mapping at the moment behind the scenes with our Enterprise Program Management Office to make sure it's all pretty seamless. And hopefully you'll see that in the reports that come out as well. Just to mention our governance, I suppose, and how it links with Future Health. This, again, looks quite complex, but the main thing is we've got in the middle there the Regional Health Committee, which is the chief executives of all the local health districts, and a Regional Health Plan Steering Committee that's made up of representatives from across districts, and that's not only health representatives, but primary health network, local government, NGOs, consumer reps as well. And then So that reports up through the Coordinator General, Luke, to the Secretary. And then we do some reporting, the alignment with Future Health. And then on the left here, you can see there's a whole lot of engagement committees that we're regularly feeding information to, getting their advice on, that feed into the development and implementation of the plan. So again, you'll see this in more detail when Luke shares the slides, but just to let you know, that's how that sort of fits. So on the last slide, when you get it, there'll be a couple of links to the plan and the priority framework, and where you'll go for getting more information, and our email box that you can always contact me through for any other information as well. So I'll just stop sharing my screen there, and I think we're going to have Q&A later. Is that Luke? Is that right, Luke?
Yeah. So we'll move into a bit of a panel discussion now, and then we'll come to some Q&A later on in the event. But yeah, thanks very much for that presentation, Michelle. Really interesting to hear a bit more about the plan. I think particularly some of that consultation work and there's the importance that people involved in that put on health promotion and prevention. That was really interesting to hear, as well as obviously those plans around the roadmaps that are to come as well. So great to delve into the regional health plan in a bit more detail. Thanks so much for that presentation. So I'd now like to introduce the panelists for the next section of the event. So to start off with, I'm going to try and spotlight our panelists as I introduce them, and we'll end up with them all up on the screen. So I'll start by introducing Emma Woolley. Emma is part of the Media and Communications team at Southern New South Wales Local Health District. She's passionate about health literacy and is a proud IUHPE registered health promotion practitioner. Emma's a member of the Australian Health Promotion Association and previously managed the regional implementation of the New South Wales Healthy Eating Active Living portfolio. She's has particular interest in infant feeding and child-friendly environments. In 2020, she completed a Master of Research at Macquarie University with a thesis on infant feeding support in long daycare settings. Prior to this, Emma has initially trained as a radiographer, working in public and private practice around Australia and the UK, and has been involved in the accreditation committee of the Medical Radiation Practice Board of Australia. Our next panelist, let me try and find them and spotlight them as well. We have Kelly Andrews. Just got you coming up on spotlight as well, Kelly. So Kelly has a Bachelor of Social Science from the University of South Australia, a Graduate Diploma of Health Promotion from La Trobe University, and a Master of Science and Research from University of Wollongong, where her research focused on asthma self-management. Kelly has a long background as a health promotion practitioner and has worked across the not-for-profit and government sectors in areas such as cancer screening and prevention, tobacco control, drug and alcohol advocacy, community nutrition, food security, physical activity, and active transport. She also spent 15 years in the university sector as a research manager at the University of Wollongong and Australian Catholic University in social marketing and public health research focused on alcohol and junk food advertising, asthma self-management, organ and blood donation, mental health and dementia-related projects. And currently, Kelly is the CEO of Healthy Cities Illawarra, a regional health promotion charity established in 1987, committed to advancing health and wellbeing outcomes by addressing social, economic and environmental causes of health inequality through advocacy, intersectoral partnership and evidence-based programs. Our next panelist is Gabby Martinez. Gabby is on our panel today in her capacity as a Upper New South Wales branch committee member. She currently is working with Illawarra Shoalhaven Local Health District in the Drug and Alcohol Service. Gabby has worked for over 20 years across various sectors, including population health, community health, and non-government organisations. Gabby has worked on a range of health promotion initiatives, including food security, oral health, smoking cessation, physical activity, mental wellbeing, and carer and consumer participation. Prior to working in health, Gabby worked in education and community sectors and brings a range of skills and experience in project management, working with stakeholders, capacity building, advocacy, and working with marginalised communities. And Gabby's also an active member of the Health Services Union, who's passionate about equity and planetary health. And our final panelist is Kylie Gwynn. So Dr. Kylie Gwynn works at Macquarie University and has more than 30 years experience in the design, implementation and evaluation of health and human services. She brings operational governance, strategy and management experience to solving complex system-wide challenges for and with priority populations, and she specialises in co-designed translational health research. So welcome to all of our panel members, and thank you for agreeing to be part of the panel for this event. Really appreciate that. The panelists have been provided with a few discussion questions in advance to help us dissect the regional health plan and what it means for health promotion in regional New South Wales. So we'll just now spend a little bit of time talking through some of those discussion questions. And as mentioned, we'll have aim to have sort of 10 minutes towards the end of the event for Q&A. If you have any questions about Michelle's presentation or anything that kind of comes up in this panel discussion, feel free to ask a question in that Q&A session, either through the chat or verbally when we come to that point. So to kick us off, I guess our first question is, how will the regional health plan impact on your work and the work of your health promotion colleagues? And yeah, if perhaps each of you would like to provide a brief 1 or 2 minute sort of response to that, maybe starting with you, Emma, if that's okay.
Yeah, sure. So I think for us in Southern, it's a bit of a shift away, I suppose, from that traditional way of health promotion working that we've done. Some of that change happened naturally through COVID and a change of focus for us. But I think the plan gives us an opportunity to work across more clinical areas, to work in partnership and to work more broadly. For us, we've been focused on smoking and pregnancy for quite a few years, and our work around that was very much traditional health promotion in, developing a lot of resources and working with that. Under the plan, we'll be able to work a bit more closely with our maternity services to help them deliver on their introducing continuity of care models of midwifery care across the region. And we think this is going to have a really big impact on smoking and pregnancy rates, because it means that women can access services earlier, they'll have a better relationship with their clinician, which means that they'll actually have that intervention earlier and hopefully in a more effective way, which is perhaps more useful than the things that we could do before. So I think it's that shift into the core business of health that we are making in health promotion that is really going to make a big difference. Yeah.
Fantastic. Kelly, so be interested particularly, I guess, to kind of hear your perspectives from an NGO as well.
I don't know if you will be, because the short answer is I can't see that it's going to make any difference unless there's some money behind it. So I'd be interested to see if the value that came up in the consultations actually translates to some dollars, some real investment in preventative health, just broadly. So, and as an NGO, we don't just work with health. We get a little bit of core funding from the Ministry of Health, but we truly work in an intersectoral collaboration model, as is across transport, across DCJ, across education. So kind of we are a really small little micro example of, I guess, the bigger picture that we're aiming for. And as a not-for-profit, we have really great grassroots relationships with our local councils and with the health districts, the PHN, on that level, but more importantly, the community centres, the struggling other, organisations on the ground that are sort of doing the grunt work. So, I love the plan, but the translation of the plan in my world, I'll be sceptical. I'll be the devil's advocate, but I think it's a really nice plan, and I like the way that it correlates with some other state sort of objectives. But as a not-for-profit partner, it doesn't change how I go about my day-to-day work. Like I said, but that's sort of I suppose that's sort of also a positive in the way that we already have existing partnerships and networks. So the reality is we do that. We just do it on a shoestring without any stability or security. But I'm really interested to see how you guys think it's going to change, the bigger picture. But that's my short answer.
No, great. No, that's fantastic. Yeah, good to get that range of perspectives. I think that's really helpful. Gabby, I guess, yeah, as we said, you're sort of, I guess, joining the panel more in your capacity as an ARPA New South Wales branch committee member. From that kind of perspective, how do you think the regional health plan will impact on health promotion work within New South Wales?
Well, I think it's great that there's a plan. It's a great plan and it's got specific targets. So that's really great to see, and that, you know, prevention is really highlighted. Often it's a poor cousin, but it's really clear in this plan. So that's really great to see. And also to see loneliness and social connection really highlighted and the focus on regional youth. Like, you know, the UK, for example, has got a minister on loneliness. There's some research happening on loneliness here, but there's not really like planned statewide work on loneliness and mental wellbeing. So that's a great start. But as Kelly said, you know, I totally agree. Practitioners on the ground have already got these sort of partnerships with council and NGOs and health, but it's really about, you know, to implement it, where's the investment going to be? Like, we can use this for advocacy, but we really need to fund these programs. This short-term funding is a real barrier to implementation. So, you know, we need like 5-year guaranteed funding for programs. So we're not always like, people aren't always like constantly recruiting staff, for example, and disrupting programs.
Right. Thanks, Gabby. And Kylie, be keen to hear your perspectives as well.
So I agree with Kelly that I think the resourcing is going to be key here, that and Gabriella made that point as well, that clearly there's a big challenge, and that was laid out very starkly in the parliamentary inquiry. And so tackling that challenge is going to require additional resourcing, but also a very different mindset, that we can't just keep doing things the same way, or more of the same things, that we have to rethink the way that we deliver healthcare in rural and remote areas. And that requires all of us to change. I mean, the other quick comment I would make is that critical partnerships with the sector, and others have mentioned that, but in particular the community controlled sector, and how we make sure that the interests of and the specific needs of Aboriginal and Torres Strait Islander patients and community members are core to this process, and any real change that can happen on the ground.
Right. Well, I think we've touched on a couple of challenges already, so perhaps maybe we kind of explore that theme a little bit further. That was, I guess, one of our other prompting questions as well. So yeah, we've picked up a couple already. Are there any other challenges that you anticipate that will impact on the delivery of this regional health plan, and how might those be overcome? And happy for that to be a bit more of an open question if anyone wants to pick up any challenges there.
I think it's just I'm not going to spit out the Ottawa Charter here and reorientate services to health. I mean, it's going to be a big shift in getting political will to do things that are going to be, the benefits are going to be seen outside their political term. At the end of the day, this is not going to be achieved in 3 years or 6 years. So the biggest challenge is for the politicians to just be brave, I guess, and do what they know they have to do. It makes economic sense. It's you know, we're all on the same page, and I do believe that they are as well. It will just be a real challenge to translate that into investment into the future. And managing the media and the community narrative around the real crisis things around EDs and ambulances and hospitals, like it's just getting boring. So they need to be brave, and they need some I don't know, support from, you know, everyone around them to invest in the future, rather than we're going to run out of band-aids, basically.
I think though, I agree with you, Kelly. I think though, realistically, that for politicians, it's very challenging to say we're not going to talk about emergency departments and ambulances. We're going to talk about prevention. So we're going to talk about drinking water. We're going to talk about smoking. We're going to talk about vaping, and that's where the resources will follow. I actually think that's why it's critically important that there is additional resources and try and hold back on our impatience for the impact of change. That change in this space will take a very long time. And so what are some of those early indicators that we can start to feel good about? What are some of the things that say we need to change so that we have a more agile approach to this and can be patient? And I think the only way to enable patience is if there are additional resourcing or resources for it. That trying to say, well, look, let's not worry about emergency department or elective surgery wait times. Let's not worry about that because the critical issue is prevention. People will not cop that, I don't think.
I think one of the key challenges for us in the public health sector is the workforce. So we have towns that don't have a GP. We have towns where their local hospital is run exclusively by locum nurses because there are no local nurses recruited there. And the side of that, apart from the access to service, is the cost of that premium labour. Running a hospital with locums is an incredibly expensive way of doing it. And the funding pie is only so big. And we all know that it's prevention that gets cut in that space because there's only so much. And we need to look at that very immediate need of our community first. So I think the plan has a really strong element of addressing those workforce shortages. It is going to be a challenge because we're all competing for the same pool of staff. But there is elements in that strategy of overseas recruitment. There's a global shortage of health workers as well. But in growing our own and providing those opportunities, increasing transport, increasing access to virtual care, looking at different models that we can use in our communities like nurse practitioners and even virtual GP services that can mean our community will have access to a GP. It's really hard to have a focus on prevention when we have such immediate needs like that.
I agree, Emma. Oh, sorry, go ahead, Gabriella.
Oh, yeah, no, I agree, like with everything that everyone has said. And I guess the only thing that, I mean, it's so hard. Prevention's always a hard sell in the political cycle. That's like an ongoing challenge. But really, I mean, our complacency about the status quo is really like the issue, because with global heating, what's going to happen is we're going to have more extreme weather events, and the climate emergency started now. Like, I think the floods in Lismore, people are still homeless as a result of it. The fires on the south coast, people are still living in tents as a result of that. Young people's mental health suffering because of, you know, such a bleak future. I mean, this is like catastrophic, and this is a clear example where we forget about prevention and we won't be able to focus on prevention at all. We'll just be cleaning up, like it'll just be one extreme weather event after the other. This is only going to get worse.
I think a couple of people in the chat have sort of picked up on those extreme weather events as well, and the impact of those and of climate change as well.
Just going back to Emma, Emma's earlier remarks, I think that workforce is really critical, but we kind of need to examine and get creative around scope of practice. And I think others have said as well that the opportunities of telehealth and different ways of working, but also how do we build a local, skilled and credentialed workforce that there's some greater layering in the system. So what is it that someone with a certificate 3 can do, and how do we make sure that there's proper supervision and support for them? And I think that some of the old debates around scope of practice, we need to reopen those and examine them more critically and see how is it that local people can be delivering local services and building capacity.
And interested to hear a little bit your thoughts around, I guess, the opportunities that might be presented by the plan as well. So I think, yeah, we've obviously sort of had a bit of a look at some of those key strategic directions of the plan and kind of some of the key areas that kind of addressing within, particularly that sort of health promotion area around maternal health, mental health. The pandemic preparedness was another one that we picked up. Our sort of wellness and prevention programs, that kind of stuff. Are there any other opportunities that you kind of see arising from this regional health plan?
I can talk about some of the things that in terms of workforce, like it was great to see Promote New South Wales Health as an employer of choice. So I think it's really timely now to introduce more flexible working conditions for health staff to address that shortage on par with the rest of the New South Wales public sector. For example, flexi time, which the public sector have had for over 40 years, local health district staff still don't have it, 35-hour weeks, which we're still working 38-hour weeks, modernisation of awards, even like to have this equity in terms of working conditions like the ministry have, like they're on a different award, shorter working week, flexi time. I mean, even if we don't get a lovely building, just the working conditions would be great. And also I think it's a good time to formalise partnerships as well. So, for example, in the liquor licensing area, I think there's good scope for opportunity, good like councils and government can work together to make sure that no bottle shops are open in childcare centres or medical centres or community centres. That we need to work more closely together so we don't approve those at the development stage. Like we often wait till, the DA is already being approved and then we put in our objection. So I think it's good for that. And also for things like coordinated action on a heat strategy, like Blacktown Council has, I think it's going to open up libraries as heat refuges. And this is, that's in the plan as well to assess and respond to environmental factors. So, for example, opening libraries on weekends, on hot nights, making sure there's food and water available. So I think that's really great. And council and health really now should be working together to address the harms from gas and coal, such as fracking in regional areas and the contamination of water. I mean, the World Health Organization has stated that climate change is the greatest threat to human health. So this is an opportunity to act.
Yeah, look, I'd agree with that. It's really, I think it's a great time for change and for innovation in the health sector. It's where we're rebuilding our workforce. We have this new plan. We have a brand new government. There's actually a lot of opportunity to change our ways of working and what we do. I'm really excited that this plan it's the first time I've seen a plan that actually acknowledges that difference of our working in rural and regional health. And I think previously we've always tried a one-size-fits-all state-based approach, which was always evidence-based, but I found really difficult to implement working rurally. I remember going to schools that had, in a really rural town with maybe 8 kids, where the kids came in from the farm each day, and I was asking them what their active transport strategy was, and they obviously don't have one. So they were. I felt like I was failing because I wasn't getting these schools over the line in some of these programs. So I'm really excited that this offers us a chance to think about how this is different. It's not even different between metro and rural. It's about within my district as well. What works in one town doesn't work in another town. So there's great opportunity to actually do some more local based interventions that are happening within our district.
And what about you, Kelly? I know you sort of spoke before being that, I guess, that sort of disconnect being in the NGO sector and not really having sort of much impact for with a New South Wales health level plan. Does this perhaps kind of I guess consolidate some of the work that you're already doing? Does it give a little bit more sort of opportunity to connect with other partners? Anything any opportunities that you see in your world?
I suppose it's just reinforcing, it's not, I mean, I guess, we've been around for 36 years, so we're sort of quite established, and we, because we're so broad, like I mentioned before, we kind of dip our toe in for, other, we have our heads in other, transport and active transport strategies and other, so it's kind of, I mean, it's not you know, you can probably tell, like, it's not, oh my God, it's Christmas. But it's, you know, it's a consolidated document that marries up to other things. So I'm hopeful that the word integrated actually means something this time around. Yeah, but from an NGO and a regional NGO perspective, where, you know, probably yeah, I guess it, I mean, it really truly comes down to resourcing for me, running a small struggling not-for-profit, unless there's investment in dollars. I really can't say this is going to change the world. That's just the reality.
Yeah, no, and yeah, helpful to have that reality for your organisation, and yeah, that, as I said, that different perspective as well. So no, thanks for sharing.
Most charities don't focus on prevention. You know, most charities focus on a disease, you know, or a crisis and a immediate need that they can fundraise for example. So our organisation's quite different in that respect. You know, it's not sexy, let's face it.
Right.
I mean, I know I've done lots of talking about resourcing here, but it isn't it, and I appreciate for small NGOs, it is all about money. That's absolutely true. It's true in the community controlled sector as well. But I think a plan like this isn't just about money, that it is about structural and behavioural change across the system. So what are the ways in which leaders are going to change their decision-making parameters to address the priorities in this plan? That I think that's the bigger challenge here, isn't it? That how do we think about workforce differently? How do we shift resources so that they can be delivered in a different way? And certainly some work we did a few years ago now in remote oral health, we found that it was possible to deliver oral health services very efficiently and within the national price if you set it up using a co-design model and had a local skilled and credentialed workforce. So it's not that it's not possible to deliver services in a different way and to respond to community needs, but there does need to be a willingness to do things differently and to think about new and different ways of delivering programs, and also that cross-sector collaboration and decision making, working out how to share power and genuinely share resources, I think is an important challenge, but one that if we can get our heads around, in fact, that's going to be key to implementation.
Yeah,
Well,
look,
sorry.
I was going to say, I'd build on that because it can be a real challenge, I think, to let go of that as health workers a little bit as well. But some of the greatest performers in this space now region are the Office of Sport, some of our NGOs, our SAC groups that are at some of our public schools. They do amazing work in this space. And it's sometimes we don't see it all, but they really will help us to deliver this plan.
Right. Well, thought, yeah, we might spend a few minutes now, I guess, opening the floor up a little bit to just some Q&A. If you've got a question, feel free to send that through by the chat. I know there's a couple that have been sent through already. You can also raise your hand and ask your question verbally if you'd like to do that. And Michelle, I might just add you to the spotlight as well as our panel as well. And I think something that did, as I said, did come up in the chat, but from a couple of people, was around that pandemic preparedness and whether that I guess that particular action has any relevance around the natural disasters that we're experiencing with greater frequency. Can you sort of speak to that? Is that kind of covered within the plan at all?
Yeah, absolutely, Luke. And thank you, Emma, Kelly, Gabby and Kylie for your comments and insights, and yeah, fantastic, really, responses. And really interesting to hear your perspectives. Thank you. Yeah, look, it is covered, Luke. I think it's, you know, we know and we know the great success and lessons we've learned through the last few years around that space. But I think, you know, it's something, as Gabby said, we have to address and we have to be prepared for, but also be prepared to respond to when they do happen. So I think that is definitely key in 3.5 in the plan. And, you know, we've had, as I said, some really good discussions with Reconstruction New South Wales, with the, you know, public health unit directors, and they've started up their own regional sort of group now as well, which is really exciting. We go along to those meetings also, so it's very much in the discussion now. And I you know, want to pick up on a couple of things that were said without, you know, regurgitating everything that was all the great insights. But and Kelly, you know, it's great if it doesn't change what you've been doing, because that's sort of the way that things need to happen. I think moving into the future, we need to think a bit differently, like Emma said, about how we do it. And now is that opportunity with that focus on regional, rural and remote health. You know, there's a new select committee that's going to pick up on the recommendations from the original rural health inquiry that we've been monitoring, and we know they're underway. But, you know, there's still that renewed focus. There's still that opportunity to hear some really good work that's been, you know, doing well and really showing good outcomes. And how do we share that as a good news story? Because you're right, Kylie, the rhetoric and the narrative has been pretty negative, and there's so many great things happening. All the innovation is happening in the rural, regional, remote areas. Not all of it, no, can't be right. But, you know, some of the great things, because people do it on the smell of an oily rag, and they do it because they work in partnership really well and they know everyone. So let's share that, and let's, you know, talk to your politicians. And that's that point about getting the community engaged in the conversation as well. So they're also driving the narrative about the really good, successful, effective work. So sorry, I need to stop talking because people might want to ask questions. Sorry.
We've got another one that was kind of posted in the chat as well. As I said, if anyone has any other questions, we might have time for a couple more before we wrap things up. This one from the chat was just asking if there was anything specifically being looked at for the neurodiverse child, particularly in regards to sort of access to assessment and interventions specifically. Is that something that's covered within this plan at all, Michelle?
Look, you won't see, you know, that specifically in the plan, but access to services, and particularly, you know, childhood services, child maternal services are really a focus, and, you know, very clear emphasis on getting and supporting people early, and particularly children. So, you know, there's a lot of work. There's a lot of work, you know, with Brighter Beginnings and a whole lot of things going on that are mentioned in the plan, and that's about working closely with education and other partners in that space. So access to services is somewhere that this really fits nicely in, and that's a variety of services, of course, including virtual, but also, you know, working in partnership, and that's that integration again of care. So you can see how the themes all sort of interweave. And Kylie, very happy to have Kylie Stark from that comment, very happy to have another conversation with you around that.
Great, thanks, Michelle. Well, I think, I don't think we've had any other questions come in. And we do only have really sort of 2 minutes to go until we come to 5 o'clock. And I know a couple of our panelists and presenters need to head off sort of straight at 5. So we might actually just wrap the event up there.
Yeah, Luke, would you mind if I just let everyone know that we are coming out to all the regional local health districts, do some roadshows about the plan. You know, we've been to Mid-North Coast and done a few already, but for example, in Southern, they're setting up a working party to actually really deliver on the plan. And that's where, you know, Kelly, looking at examples of what you're doing in healthy cities, you know, if local health districts can really get on familiar with things and start to think about what are some good work that's already happening, we'll share those at these roadshows as well. So please feel free to reach out to me or, you know, your local health district's executive staff around when the roadshows are coming. We'll start with the leadership team and get them all engaged in the plan and finding out where everything fits, and then we'll you know, do the more community engagement. But yeah, the offer's there to be part of those roadshows and hear more about the plan, and a chance to hear about it at the local health district level, as well as to our partnerships, our partners, you know, universities, PHNs, anyone. Really happy to do further presentations and discuss what the plan means to you and how you can see yourself in the plan.
Great, thanks, Michelle. Well, yeah, I'd just like to thank our speaker and our panelists today. So thanks to Michelle, thanks to Emma, Kelly, Gabby and Kylie. Thanks for all your insights and expertise and your involvement in this event. Really appreciate it. Thanks everyone who's joined today. It's been great to have you as part of the event, and I hope that it's been informative and useful for you all as well. And I'd just also like to thank the Upper New South Wales branch for their support in the planning and delivery of this event, particularly Joe, Miriam and PH as well. So thanks everyone for joining today, and hope you enjoy the rest of your afternoon.
Thanks, Lou.
Thank you.
Bye.